Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide the COVID-19 pandemic update with data accurate through November 11th, 2021. As I've been doing in the last few weeks, I'm going to cover this week's news in 3 minutes, and this week I'm only going to address one issue, and that is that there has been some controversy in the news about promoting the COVID-19 vaccine for young children, and I'm sure you all have seen it. And it's certainly understandable. I'm a father of 5 and have 4 grandchildren. I'm trained as a pediatrician. I certainly understand the concern that people have to be sure that they're doing the right thing for their children. So I would simply say 2 things to parents that are considering this. The first is get accurate information. There's only so much information out there. If you go to either of these 2 websites, the FDA site or the CDC site, you can get all of the information that's out there. Anything anyone tells you beyond that information is probably speculation on their part. But the second and more important thing I'm going to say about it is please don't confuse the discussion about the COVID-19 vaccination with the importance of vaccination for kids in general. One of the great public health advances of the last century has been our ability to control infectious diseases. And you see this with life expectancy. 100 years ago, at the beginning of the 20th century, 120 years ago, life expectancy was 47 years. In the course of the century, it went up by 30 years. It's a phenomenal change. But perhaps even more impressive if you look at what we were dying from. 120 years ago, 2/3 of Americans were dying from infectious diseases. Today, 2/3 of Americans are dying of chronic diseases, and only about 3 to 3.5% of Americans die from infectious diseases. Our ability to control infectious diseases through hygiene, sanitation, and immunization has been remarkable. In fact, if you look at the last century, most of the advance in life expectancy took place in the first half, long before most of our modern medical advances. And you can see this really graphically. If you look at life expectancy in England, going back to 1765, you can see that while it was going up slowly, in the late 1800s, life expectancy started to shoot up because we learned the germ theory. We learned that the number one killer of humans was infectious diseases. And they are still important today. A recent study that just came out a couple of months ago looked at the impact of 10 vaccines in 112 countries around the world. And they determined that without vaccines in the last 20 years, there would have been 50 million additional deaths, with probably 47 million more in the next decade, just from those 10 diseases in those 112 countries. And even in our country, another report estimates that 42,000 children's lives are saved each year because of vaccinations. So it's certainly understandable that people want to get the best for their kids, and they want to question the COVID-19 vaccine. I believe in it. I want my grandchildren to be vaccinated when they're eligible for it. But I understand why parents are concerned. But please, do 2 things. Get your own information, and if you need help, someone to give you advice, talk to your healthcare provider. They're much more reliable than some of the folks that you might hear otherwise. But the second and most important thing, don't confuse this discussion with a discussion about the importance of vaccines. Vaccines are critically important. It would be a huge loss to our health and well-being if we were to step away from vaccines now. There's a great deal more information about COVID-19 on the College of Public Health website. If you'd like to be added to our mailing list, please let us know. Thanks as always to Dara Young for editing, producing, and posting this video. And if there's any topics you'd like to see me address in future weeks, please let me know. I look forward to hearing from you. Until then, please be well. Thank you.